Hello, my name is Kristen Harris and I'm a student in Dr. Levy's online course, Introduction to Special Education. I'm taking this course to fulfill requirements to be a New York State certified special education teacher. Presently, I'm a SpEd, or Special Education Itinerant teacher in Brooklyn, New York. I service preschool children with special needs in their homes and in preschool settings. Today, I'm going to speak about auditory processing disorder. Auditory processing disorder, sometimes called central auditory processing disorder, refers to difficulties in the perceptual processing of auditory information in the central nervous system as demonstrated by poor performance in one or more auditory skills. Skills include sound localization lateralization, auditory discrimination, auditory pattern recognition, temporal aspects of audition, including temporal integration, temporal discrimination, temporal ordering, and temporal masking. Auditory performance in competing acoustic signals that also include listening. In layman's terms, a problem exists in a person's brain that prohibits them from interpreting auditory signals correctly. This disorder may affect as many as 10% of the population of children in the United States, but it is little recognized and much less publicized. Here's a list of symptoms associated with the disorder. Special educators play an important role in the treatment of children with auditory processing disorder. Teachers must first examine the specific needs of the child. If a child has difficulty following two-step directives in the presence of background noise, strategically place yourself close to the child when delivering instructions, and remember to provide visual cues. For example, if the directive is, go to your cubby and get your coat, first provide a picture of the child's cubby, and next a picture of their coat. Teachers must deliver their directions in the simplest form possible. Wash your hands at the sink becomes wash hands. Teachers must also provide activities that build upon the child's weaknesses. Discrete trials to target following directions, discriminating, sorting, and phonological awareness activities can be of great help. Special educators are part of a team that serve children with auditory processing disorder. The multidisciplinary team includes a speech and language pathologist, audiologist, and may include a psychologist, building administrator, social worker, special educator, parent, and general education teacher. Next, I'll show you a clip of one of my students with suspected auditory processing disorder. He's 3 years and 6 months of age. He was observed by my supervisor, an experienced certified behavior analyst, to exhibit symptoms of processing disorder. A diagnosis could only be conclusive when the child is assessed by an audiologist. Unfortunately, such diagnosis cannot be reached until the child is 7 or 8 years of age, because there's such striking variability in brain function in younger children. In the clip, the child is receptively identifying objects by their feature, function, and class. That is, by their attribute, what they do, and what category they belong to. This item tests discrimination, a difficult task for children with auditory processing disorder. Mastering this skill in smaller fields in a distraction-free environment will allow him to build upon the skill, eventually discriminating between larger fields in a noisier environment. Show me the one that's an animal.
I have to go.
That is an animal. It's a cow. Nice job. Soon you'll need,
I have to go.
Show me the one that's a plant.
Plant. This one.
Excellent. The flower is a plant.
Easy.
Show me the one that's yellow.
Yellow. This one is yellow.
Very nice. The bus is yellow. Show me the one that we build with.
Blue.
Very nice. We build with a block. Show me the one that's white. That's white. Part of the cow is white. Which one is more white? the tissue is more white than the cow. Nice job.